Hi, today we gonna talk about thyroid and parathyroid glands diseases. First, the thyroid gland. It can be increased in its hormones secretions, then called hyperthyroidism or thyrotoxicosis. Or it can be decreased in its hormones secretions, then called hypothyroidism or myxedema, or cretinism if it in infancy. Hyperthyroidism or thyrotoxicosis, caused by toxic diffuse goiter, which is the commonest, and can be called Graves' disease, or caused by toxic multinodular goiter, or Hashimoto's thyroiditis, or excess production of TSH, thyroid-stimulating hormone, or exogenous intake of thyroxine. Thyrotoxicosis or Graves' disease is an autoimmune disorder consist of hyperthyroidism and painless diffuse goiter, or ophthalmology, or dermopathy. The patient mostly come with intolerance to hot weather, polyphagia with low weight, diarrhea, muscle weakness, amenorrhea in females and impotence in males, high pulse rate, that may reach in sleep 1 to 100 beats per minute, cardiac enlargement or heart failure, insomnia and anxiety, an enlarged firm gland, and if complicated to thyrotoxic crisis the patient comes with high fever, and severe tachycardia, and hypotension, and tremors, and hepatomegaly or abdominal pain, and markedly irritable. Myxedema, or hypothyroidism caused by Hashimoto's thyroiditis, or idiopathic atrophy of the gland, or infection, or iodine deficiency, or decreased TSH for any reason. Hashimoto's thyroiditis is an autoimmune disease. Occurs when your body makes antibodies that attack the cells in your thyroid, leading to goiter or enlargement, and is the commonest cause of hypothyroidism. The patient mostly come with a history of post-thyroidectomy, or antithyroid drugs, fatigue, intolerance to cold, weight gain, puffy eyelids, large tongue, some serious effusion is pericardial effusion, constipation, impotence in males, and in females menorrhagia in primary hypothyroidism, so may happens anemia, and amenorrhea in secondary hypothyroidism, and dry pale cold non-sweaty skin, and hair loss, and hypercholesterolemia, and sinus bradycardia, and depression. And if complicated to myxedema coma, the patient may come with hypothermia, and loss of consciousness, and hypoglycemia, and hypoventilation, and hypotension. Cretinism is hypothyroidism in infants. The cause may be congenital, or caused by iodine deficiency, or antithyroid drugs during the pregnancy. The infant may have persistent jaundice, or hoarseness crying, or feeding problem, or big lips, or protruding tongue, and may happens delay in walking or dentition, and mental retardation, so should be treated in the first 6 months. Second, parathyroid gland. It can be increased in its hormone secretions, then called hyperparathyroidism, or it can be decreased in its hormone secretions, then called hypoparathyroidism. In hyperparathyroidism, happens increasing to the gastrointestinal tract absorption of calcium, and increasing to kidneys reabsorption of calcium, and increasing kidneys phosphate excretion. Causes are primary as parathyroid gland adenoma or hyperplasia, or secondary to chronic renal failure. The patient mostly come with osteitis fibrosis cystica, and pain, and pathological fracture, and renal stones, polydipsia, polyuria, and peptic ulcer, and constipation, and depression, and arrhythmia. Hypoparathyroidism, or tetany status. Hypoparathyroidism caused by any reason as we explained earlier. Tetany caused by hypocalcemia and hypomagnesemia and alkalosis. That was all today. Thanks for listening. I hope you learned something. Thanks again and subscribe for more.